You wake up this morning and something feels slightly off. Not dramatic, not an emergency, just off. Maybe your mouth feels a little numb on one side. Maybe you notice that your words are coming out a tiny bit slower than normal. Not slurred, just slightly deliberate. Maybe you have a headache that is different from your usual headaches. Not worse, just different. In a location or with a quality you cannot quite name. Or maybe you reach for your coffee cup and your hand does not quite grip it the way it usually does. You tell yourself you did not sleep well. You tell yourself you are stressed. You tell yourself it is nothing. And then you go about your day, and most of the time, in most people, it is nothing. But in some people, and I need you to listen to what I am about to tell you, because you may be one of those people. Those small, almost invisible signals are the stroke announcing itself the day before it hits. I am Dr. Michael Hart. I have spent 34 years in neurology and stroke medicine, and I have sat with more patients and families in the 24 hours after a major stroke than most people could count. I have heard the same words repeated over and over again. He seemed fine yesterday. She was normal this morning. We had no idea. And every time I hear those words, I think the same thing. No idea. Because nobody had ever explained to them what a pre-stroke day actually looks like, what the quiet warning signs actually are, what to pay attention to, and exactly when to stop dismissing the small things and start taking them seriously. The statistics that keep me up at night are these. The American Stroke Association estimates that approximately 800,000 people in the United States suffer a stroke every single year. 1 every 40 seconds. But here is the number that matters most. Approximately 80% of strokes are preventable. 80%. Not through surgery, not through emergency interventions after the stroke has begun, but through recognition and action in the hours and days before the stroke happens. Because strokes do not usually announce themselves with a lightning bolt. They announce themselves with whispers. And the tragedy is not that the whispers are hard to hear. The tragedy is that most people have never been taught to listen for them. By the time this video ends, you are going to know exactly what those whispers sound like, what is happening in your brain when you experience them, and exactly what to do the moment you recognize them. And stay with me, because the most dangerous pre-stroke signal is not the one everyone talks about. It is the one almost nobody recognizes until it is far too late. It is the one that happens in the days before the stroke, not the hours before. And once you know what it is, you will not be able to unsee it if it ever happens to someone you love. A stroke, in the most basic neurological terms, is a sudden interruption of blood flow to the brain. That interruption can happen in two primary ways. First, and this is the most common, accounting for about 87% of all strokes, a blood clot forms or travels to a cerebral artery and blocks blood flow. Second, a blood vessel ruptures and bleeds into the brain. The mechanism differs, but the urgency is identical. Your brain, unlike almost any other organ in your body, cannot tolerate even brief interruptions of blood supply. Brain cells begin dying within minutes of oxygen deprivation. Minutes, not hours. Minutes. And the difference between a stroke that leaves someone with minor disability and one that leaves someone partially paralyzed, unable to speak, or dead often comes down to whether intervention happened within 3 hours of the first symptom. 3 hours. We call this the treatment window. And recognition of pre-stroke symptoms in the hours and days before the major event can mean that when the stroke begins, you are already in the hospital, already monitored, already at the beginning of the treatment protocol, instead of racing against time trying to get there. I want to tell you about a patient named Ellen, 68 years old, retired librarian from Portland. Ellen came to me 6 months after a major stroke that had left her with significant aphasia, difficulty finding words, and partial paralysis on her left side. She told me that in the 3 days before her stroke, she had experienced what she called small, strange things. A fleeting numbness in her left hand that lasted maybe 30 seconds, then went away. A moment where she could not quite think of the word for something, which was very unlike her, and then the word came to her, and she forgot about it. a slight clumsiness when reaching for things, a headache one afternoon that felt slightly different from her usual tension headaches. She mentioned none of these things to anyone. She did not call her doctor. She did not tell her husband. On the morning of the stroke, her husband found her on the kitchen floor, unable to speak. She was taken to the hospital where imaging showed a major arterial clot in her left middle cerebral artery. She received treatment, but the delay, those 3 days where she had experienced warning whispers and done nothing, meant that the treatment came after significant damage had already occurred. When I sat with her months later, after her long rehabilitation, she said something I want you to hear directly. She said, "If I had known that those 3 small things meant something, I would have gone to the hospital immediately. I would have done anything, but nobody had ever told me that a stroke announces itself days before it happens." That is what this video is about, that announcement. What it sounds like, what it means. Let me walk you through the mechanisms, because once you understand what is happening in your brain when you experience these pre-stroke signals, you understand why they matter. In the hours and days before a major thrombotic stroke, a stroke caused by a blood clot, several biological processes are occurring simultaneously inside your brain and blood vessels. The process almost always involves the formation of a thrombus, a clot, which typically forms when fatty plaque ruptures inside a blood vessel. When plaque ruptures, your body detects injury and activates the coagulation cascade, a series of biochemical reactions designed to stop bleeding. Platelets rush to the site. Fibrin threads form. A clot begins to build. In a young, healthy person, this clot formation is controlled and localized. In an adult over 60 with atherosclerosis, buildup of plaque in the arteries, this process can spiral. The clot grows. It begins to impede blood flow, and before it completely blocks the artery, it creates what we call a transient ischemic attack, a TIA, a temporary reduction in blood flow that causes symptoms that mimic a stroke, but resolve within minutes to hours because the clot temporarily dislodges or dissolves. A TIA is not a minor event that you should dismiss and move on from. A TIA is a warning. It is your brain telling you that a clot-forming mechanism is active in your cerebral circulation. A patient who experiences a TIA has approximately a 10% risk of experiencing a major stroke within the next 48 hours. 10% in 48 hours. That is an emergency-level risk window. And most people who experience a TIA think it was nothing because the symptoms went away. That is precisely the dangerous thinking we need to change. But the pre-stroke signals in the days before a TIA or stroke are often different from the dramatic loss of function signals everyone knows about. They are subtle. They are easy to dismiss. And they require you to know what you are looking for. Here are the 7 pre-stroke warning signs that appear in the days before a major event. The first one is transient vision changes. And I want to be very specific about what this means, because it is different from simply getting older and needing reading glasses. I am talking about a sudden dimming of vision in one eye, not both. A sudden blurring that lasts seconds to minutes and then clears completely. A sudden loss of peripheral vision on one side, even if it lasts only briefly. These are signals that the blood supply to your visual cortex, or optic nerve, is being temporarily compromised. If you experience this, even if it completely resolves, this warrants immediate medical evaluation. Do not wait. Do not assume it will happen again before you act. Tell someone today. The second pre-stroke signal is fleeting numbness or weakness on one side of your body. And here is why this is easy to miss. It might last 10 seconds. It might last 2 minutes. Then it resolves completely and you feel normal again. A tingling in your left hand, a momentary weakness in your left leg, a feeling that part of your face has gone numb for just a moment. These are transient ischemic events. They are your brain telling you that circulation in a specific region is being compromised. When you experience fleeting one-sided weakness or numbness that completely resolves, you are experiencing a warning sign that your doctor needs to evaluate immediately. The third signal is sudden, brief difficulty speaking or understanding speech. Not being tired or distracted. Not struggling to find a word that you eventually remember. An onset of either slurred speech or difficulty understanding what someone is saying to you, even if it only lasts for seconds. This indicates a temporary disruption of blood flow to your language centers, Broca's area or Wernicke's area. and is a serious pre-stroke indicator. The fourth signal is a sudden, unexplained headache that is distinctly different from your usual headaches. Not worse necessarily, but different. A different quality, a different location, a different sensation. Many people over 60 have chronic tension headaches or migraines and have learned to live with them. But a sudden new headache, one that breaks the pattern you have established, is a signal worth investigating. Some pre-stroke headaches are accompanied by vision changes or neck stiffness. Some are not. The difference is in the novelty. If your headaches change patterns suddenly, that is worth a doctor's evaluation. The fifth signal is sudden loss of balance or vertigo, a distinct spinning sensation that is new to you, or a sudden stumble or clumsiness that is not explained by injury or fatigue. Balance is controlled by multiple brain regions, and a sudden disruption to any of them can produce these symptoms. If you suddenly feel dizzy or unsteady in a way that is completely new, this warrants evaluation. The sixth signal, and this is where I see the most dangerous delays, is a sudden, unexplained difficulty with complex cognitive tasks. You sit down to balance your checkbook, and the numbers feel jumbled in a way they never have before. You try to follow a recipe you have made 100 times and suddenly cannot track the steps. You cannot seem to organize a simple task that you usually do automatically. These are subtle. These are easy to attribute to distraction or stress, but a sudden new cognitive fog, a sudden difficulty with tasks that are usually automatic for you, can indicate early ischemic changes in your frontal or parietal lobe. And here is the signal that I promised you, the seventh and most dangerous pre-stroke warning that almost nobody recognizes. It is sudden, unexplained anxiety or a sense of dread that is completely out of proportion to your circumstances. You are sitting at home. Nothing bad is happening, but you feel an overwhelming sense that something is terribly wrong. A sense of impending doom, a sudden panic that you cannot explain, a feeling that something is happening inside your body, and you do not know what. I've had dozens of stroke patients tell me that in the days before their stroke, they experienced a sudden, unexplained anxiety that was completely unlike their normal emotional state. Anxiety that made them want to go to the hospital, but they talked themselves out of it. Anxiety that they attributed to stress, or the news, or hormones. But when we looked back at their brain imaging after the stroke, we could see that the signal they were feeling, that physical sense of something being wrong, was their brain literally telling them that something was wrong, that their circulation was being compromised somewhere in the regions that regulate emotion and fear response. Many of them told me afterward, if I had known that the feeling itself was the warning sign, I would have gone to the hospital immediately. I need you to hear this directly. If you experience any one of these 7 signs, even if it completely resolves, you need to contact your doctor or go to an emergency room and describe what you experienced. You do not need to wait for it to happen again. You do not need to see if it was serious. You do not need to call later. You need to seek evaluation because your brain is telling you something, and the time to act is before the major event, not after. If this is the first time anyone has explained the pre-stroke warning signals that actually appear before stroke happens, not just the dramatic stroke symptoms everyone knows about, but the whispers in the days before, please hit that subscribe button right now. This channel exists to give adults over 60 the information about their health that your doctor does not have time to explain. Every video is built on published medical research and explained in plain language. Subscribe now. I want to come back to Ellen one more time. Months after her stroke, after intensive rehabilitation, she told me that she had made a decision. She was going to start a support group for stroke survivors, specifically focused on recognizing pre-stroke symptoms in family members and friends. She said, "What happened to me cannot be undone, but if I can help even one person recognize those warning signs in time, then my stroke means something." Ellen is now 3 years post-stroke, and her speech has recovered significantly. She still has some residual weakness on her left side, but she is walking, talking, living independently, and she is actively working to teach others about the signals she missed. She said something that I think about constantly. The stroke that I survived was the one I should have prevented. That prevention started with knowing what to listen for. That prevention started with recognizing that the small things matter. Here's what you need to do today. Step 1. If you have experienced any of the 7 pre-stroke signals I described, Call your doctor today. Not next week, today. Use these words. I experienced a sudden episode of weakness, numbness, vision changes, or speech difficulty that has since resolved. I want to be evaluated for stroke risk. Those words will get you an appointment or an ER visit immediately. Step 2. If you have ever had a TIA in the past, you are in a high-risk category. Check your medication. Ensure you are on antiplatelet or anticoagulant therapy as prescribed. Do not miss doses. If you have not been prescribed stroke prevention medications, ask your doctor about this at your next visit. Step 3. Know the FAST acronym. Face. Does one side of the face droop? Arms. Can you raise both arms equally, or does one drift down? Is speech slurred or difficult to understand? Time. If any of these are true, call 911 immediately. This is the protocol for active stroke recognition. Learn it. Teach it to someone else. Step 4. If you are over 60 and have never been screened for atrial fibrillation, an irregular heartbeat that dramatically increases stroke risk, ask your doctor about this at your next appointment. An EKG takes 5 minutes and can identify a condition that increases your stroke risk by 5 times. Step 5. Share this video with one person in your life over 60 today. Someone whose health you care about. You may not know whose life this information protects. Before you go, I want to ask you 2 things. First, write your age in the comments right now. Just the number. The age of this community shapes every video I make, and I read every single comment personally. Second, have you or someone you love ever experienced any of these pre-stroke warning signs? Did you recognize them at the time? Tell me in the comments. Your answer might be exactly what someone else needs to read. And before you close this video, there is another video on this channel that covers the blood pressure pattern that increases stroke risk more than any other single factor, and it is the one almost nobody talks about. Go watch it now. What you learned there completes the picture that this video started. Your brain has been working for you every second of every day for over 6 decades. It has never asked for anything in return except blood flow. Give it the attention it deserves. I am Dr. Michael Hart, and I will see you in the next one.